Mama let me drive the old Dixie station wagon into town, but I had to take the levee road. I couldn't stay on the main road because I grew up out of Surfside Beach. Okay. I'm gonna let y'all out a little bit early today because we are gonna take pictures today. So if someone could let me know at 11:30, because I'm terrible with checking my watch. Okay, a little bit early today. So in X-ray, I am registered in radiology and I'm registered in mammography. In ultrasound, I'm registered in breast, OB-GYN, and abdomen. So, like I said in orientation, please don't stop here. This is just entry level for you. Okay, we want you to go further. Okay, we really, really want y'all to go further. We want you to be better than we are. Okay, because you might be where we are now. You know, you'll be training the next generation of imaging professionals. Okay, so we want you to succeed. My phone number is 713-446-3195. If you have any questions, you can text me. Don't text me after 9 because at half the time I don't even have my phone in the house. I usually leave it in the car or it's in my purse. Okay, so goals and objectives is that we want you to succeed. We're going to teach you how to talk to your patients. We're going to teach you how to introduce yourself to your patients. We're going to show you how to transport your patients and how to talk to other imaging professionals and to the nurses up on the floor and the physicians that you come in contact with. Okay? The radiology program is required to instruct and evaluate students in cognitive, psychomotor, and affective domains. That is just a statement that comes from the JRC, and we have to have it on our syllabi. Okay? In other words, we're going to teach you how to think on your own, how to solve your problems, and how to work by yourselves. Okay? We do require you to complete all assignments on time, to attend class regularly, okay? Because when you miss a class, it's harder to catch up. Who's read the chapter? It's long, isn't it? It took me probably 2 hours to read the chapter last night because I'm studying at the same time you are, okay? Because I haven't taught patient care since '08. So as you're learning it, I'm learning it too. So as you're reading, I'm reading, okay? So we do expect you to have class participation because we are going to have several things. You're going to have a test on AIDIT, and I'm going to tell you what that is. You'll also have a test on hand washing that I know of, okay? This is the book. Everybody's got the book, right?
Yep.
Okay. Lectures are 35%, hand washing is 30%, and your final is 35%. Hand washing, guys, you've got to get it down because they have secret shoppers in the hospitals, and you'll get a pink slip. Got a pink slip, that's the only reason I know that. I had been up on portables. I was going to pull the machine out of the room, and then I was going to find some place to wash my hands. Well, the room had a sink in it, but I didn't wash it in the sink. I pulled my machine out, and I got dinged. I was supposed to have washed my hands before I touched my machine to take it out. Okay? So I told them I didn't know that that was the procedures, and I got a slip, I got verbalized, they gave me a verbal warning, they tutored me on it, and so if you're, learn from my mistakes, that if there's a sink in your room and you're on portables, be sure to wash your hands. How we tell you to wash your hands before you ever touch your machine to pull it out. Okay? The grading system is the same for all of your classes. We expect you to make a 76 or higher on all practicums. Okay? Attendance, you can miss 3 classes, but you will have to make those 3 classes up during makeup week. Now, the summer semester is shorter than all the semesters, because you're only with us for what, 11 weeks? I think 12 weeks counting the makeup week. So if you don't miss any classes, you're off all week, okay? Monday through Friday, because I'm sorry?
The makeup week?
The makeup week.
Okay.
But that's also your summer break, okay? So if you don't miss any time, you're off for that week of summer break. If you have up time, you have to make it up during that week also, okay? Because the last day of the semester is April the 2nd. Now, your juniors, usually what we do is we have makeup week. It's always done in the clinical setting. Well, y'all aren't even in clinic yet. So I'm gonna have to sit with Mr. Donahue and find out exactly how we're gonna do makeup week for you. I know one of you is already gonna be off because they've already talked to me about it. And so I'll know before, when Mr. Donahue gets back next week. I've already got it on my list of things I need to talk to him about. Okay? Yes.
So, like, I remember them saying if we leave early a day, that counts as a day off or an absence?
An absence. If
So
you
if
leave
I-
before 2 o'clock. If you leave at 1:59, it's an absence. If you leave at 2, it's an early out.
Okay,
So be very, very careful whenever you're clocking out.
So how does the early out work for the makeup time?
You get 3 of those.
Okay, so you still have to make up the whole
Yeah.
day? Okay.
Absence, yes, you have to make up. Early out, you don't have to make up.
Oh,
An early out counts the same thing as a late. If you are supposed to be here at 7 and you get here at 7:01, you're late. Okay, you get 3 of those. Okay? Early outs. If you leave from 2 o'clock to 2:59, it's an early out. That's also under the same category as a late. So between those 2, you get 3 of them. Okay, so you can either be late or leave early 3 times and not get dinged for it. Is that understandable?
Yeah.
Okay. So during exams, you have to have your phones on the off. They can't be on vibrate, and they have to be face down on the corner of your desk. They can't be in your backpack. If you have them in the classroom, they have to be visible. Why? We've caught people stealing. We've caught people cheating. Okay? That's why. So we want to see them on your desktop, right-hand corner, face down. On vibrate, on off, not vibrate. Okay. So first off, we're gonna go finish up the syllabus today. And we're gonna get to know one another, because I'm sure all of you don't even know each other's names completely yet, okay? Find out where each of you live, because it's gonna be imperative for you. Like if 6 of you live in Tomball, why don't y'all carpool together, okay? If 4 of you live in Katy, why don't y'all carpool together? Because we try to keep if you've got that many in one area, we try to keep those students together. We try to keep them in the same labs. We try to keep them in the same clinical sites. We can't always guarantee, because we've got to split y'all off between, sometimes. But the majority of the time, we try to keep y'all together. Okay? So what we're gonna do today is we're just gonna get to know one another, and we're gonna go a little bit over the chapter. I'm gonna go ahead and start the PowerPoint, so that way, excuse me, because we're gonna role play that last little bit of this class before we go to the next chapter, okay? Now, I don't understand the pronoun things, like he, she, them, they. You know, I'm 68. You know, if it says male, you're Mr. If it says female, you're Miss or Mrs. You know, I don't understand the pronouns. And I'll be the first to admit, my granddaughter got so mad at me the other day, she went into her bedroom, slammed the door, and the picture came off the wall. Because I said, well, I don't understand what you're trying to tell me, because I don't understand the pronouns. So let me tell you a story about this. So I was working at Bentob, and it was a scrotal exam. Okay, so I mean it's a scrotum, right? It's a Mr. Mr. Alvarez, and the most beautiful woman stood up. I mean, this woman was beautiful, and she, in her high heels, she pranced over to the room and stuff. And I said, well, I need for you to take everything off from the waist down. And I did her scrotum. Okay? So the month of June, I was sick. I was in the hospital 3 different times, had 3 different surgeries on my kidneys because I had a kidney stone. And I noticed how they call the patients in. Okay, so I'm going to use Miss Bonilla. Okay? Bonilla, hi, my name is Miss Shepherd, and I'm going to be your technologist today. Did I check your arm band? Okay. So you can go ahead and just follow me. Okay. Go ahead and have a seat right here. Okay. Miss Bonilla, what we're going to do today is we're going to look at your right upper quadrant. What kind of problems are you having? She goes, well, my pain is on the left side. It's not on the right side. I said, well, your doctor's ordered the right upper quadrant. So let me go and check with the front desk. Because we're all human, right? I make mistakes. You make mistakes. You make mistakes. I mean, we're human. So when the doctors and the nurses or the front desk are ordering these exams, it's just a click of a button. Okay? But I can't do her right upper quadrant because she's hurting on the left upper quadrant. So I'm not going to do her exam without calling the doctor. So luckily at the hospital or at the clinics, we just give it to the front desk. Okay? I'm not going to take her out of my room, okay, because I want to fix her problem first. I'm not going to take someone else in front of her. Okay? I'm going to call the front desk. I'm going to go to the front desk and say, I think they've ordered the wrong exam on this patient. Could you follow up on that? And I've already got the patient in the room. So I've let them know I've got the patient in the room. I'm not taking her out. I need for you to do it now. Okay, so this is the thing. You're the technologist. The buck stops with you. Understand what I'm saying? If you do the wrong exam or you do the wrong patient, it's going to be you that's liable. It's not going to be the front desk. It's not going to be the ordering person. It's going to be you. You're the professional. If you think you've got a mistake, listen to that good angel. Don't listen to that bad angel. Okay? Because that bad angel's going to say, oh, just do the order. Do what the doctor says for you to do. But the good angel's saying, but that's not where her pain is. The bad angel says, but that's what's ordered. The good angel says what? Don't do it. Take your time, call the doctor, and make sure. Okay? So, in imaging, we all have that good and the bad. We all have it. If you're having a bad day, most of the time I'm going to listen to the bad one. If I'm having a good day, most of the time I'm going to listen to the good one. Okay? 9 times out of 10, if I listen to the bad one, I'm going to get in trouble. Okay? If I get in trouble too many times, then I get a pink slip. Why? Because I'm not using my common sense. We have to use our common sense. okay? Because the buck stops with me, okay? What happens after I finish the exam? I take it to the radiologist to be read, okay? As far as he knows, everything's in order, right? So he reads that right upper quadrant. He never even questions the left upper quadrant pain. Okay? He's not even going to question it because he knows that I've already done my job. Got it? So he is betting. So what happens? He has to go to court because I missed a spleen cancer. Okay? It's not going to be me that has to go to court. It's going to be my radiologist that goes to court. See how the ball rolls? With imaging, you have to make sure that every image that you take is a diagnostic image. Because every image that you take could end up in a court of law. Okay? Every image you take could end up in a court of law. And that's the way you have to think about it. If your good angel says, you know, that's really not a very good image. It's a little bit light. Can't really see the good bone material. Take it again. Do you have to do that now, or can you change that with digital?
Some images you can manipulate it, but
With the majority.
That you
Okay.
have to repeat.
Okay. So, now, as you know, it is ionizing radiation. So we don't want to take a lot of repeats. But we all take them. We all have to take them because the first one, either the patient moved or I had the technique wrong or the anatomy's not good. Okay. Now, whenever I was, let's go back. So, whenever I was talking to Miss Bonilla earlier, that's called AID IT. Let me pull up the presentation. Oops, did the wrong one. Okay. So, when we talk to our patients, there's a certain language that we want to use. We don't want to say, oh, Miss Bodilla, we're going to take a picture of your tib fib. My tib fib? What's that? What am I going to say? Huh? I'm just going to say I'm going to take a picture of your leg. Okay? I'm not going to use the medical terms because she has no idea what I'm talking about. Okay? If I'm taking a picture of an elbow, I'll say I'm taking a picture of your elbow. I'm not going to say, well, we're going to look at your electronon process. You know? You know? So, talk to your patients like a patient. Like if I talk to a radiologist, say, well, there's a fracture of her electronon process, it looks like. You know, are there any more images that I can get for you, doctor? Okay? Okay, so whenever we have a script, and you're going to develop your own script as you go on. My script hasn't changed in 54 years. I still use the same script. Okay? I still use the same script. Now, when I was in the hospital last week, I was in a waiting room, but then they had to walk me quite a ways to the x-ray machine. Okay? That person that came and got me, this is how they did. They didn't say follow me. They didn't say anything. They didn't talk to me while I was going to the exam room. They didn't do anything. They just turned around and walked off. It would have been nice to say, so I hear you've got kidney stones. How long have you been bothering? How long has that been a bother to you? Or we're taking you to a room and then we're going to get you undressed, put you in a hospital gown. They didn't tell me anything like that. There was nobody else in the hallway to hear our conversation, but it took, 5 minutes to walk to the examination room, and the patient didn't say the technologist didn't say anything to me. I didn't like that. I'm more personable. Okay? Miss Bonilla, I see that you're having problems with your elbow today. Did you fall? Are you okay? Was anything else hurt? Anything I need to tell the radiologist? Okay? Oh, that must have been embarrassing. Did it happen at work? Did it happen at the grocery store? Oh, I'm just like Chatty Cathy. But what am I doing? What am I doing?
Developing information.
I'm getting information. I'm being nice. Okay? Now, I can tell if Miss Bodilla wants me to talk to her or not. Because I'm going to listen to her and I'm going to watch her body language. She might be in so much pain, she doesn't want to talk at all. She doesn't want me to ask any questions. She just do the exam, get me out of here. Whatever I need to do. Okay? So pay attention to the body language that you also see from your patients. Okay? I'm always going to introduce myself. Hi, my name is Georgette. I'm your sonographer today, or your technologist today, and we are going to take you into an examination room, and we're going to do an abdominal exam. You need me?
Do you mind if I borrow a student?
No, go ahead. We're just talking. Okay? Okay. Now with back to the acknowledge. The whole he, she, them, they. Did you notice that whenever I said Bonilla, I just called the last name. I didn't say Mr., Mrs., whatever. That's one way to get around that them, they, her, she, whatever the pronouns are now. Y'all might understand that. I don't. Okay? But just like the scrotum that I did, I felt really embarrassed because I said Mr. Alvarez, and a woman stood up. I felt so bad that I embarrassed him. Okay? That was probably 25 years ago. I still remember it like it happened yesterday. Okay? And I can still remember how I probably made him feel. Okay? So, I'm teaching you not to say Mr. or Mrs. Just call the last name, ask for identification, check their armband to make sure that they're the same person. Okay? I'm going to introduce myself. Hi, my name is Georgette. I'm your technologist today, and I'm going to do your abdominal exam today, and you'll be in with me for about 20 minutes. But first off, I'm going to have you take everything off, and except for your panties or your underwear, depending on if I'm talking to a man or a woman, and open the gown to the back. If you need help, just let me know. Okay? So I've already told them how long it's going to take, and it's all part of my script. It's what I always say. I'm going to say the same thing today that I'm going to say tomorrow, because that's my script. Okay? That's my script. And you're going to develop your own. We're gonna teach you the basics on AIDIT, but you're really gonna develop your own. Okay? Just like you're gonna develop your own in your examination room. Like me, I like to have everything set up. So that way when the patient comes into my room, that patient has 100% of my attention. I'm there to answer any questions. I'm there to explain the exam. All I have to do is do the exam because everything's set up. But used to, you had to do all these films. Now I think everything's digital, so it's easy. But I'm going to have everything ready. So all the patient has to do is lay down on the table. I'm going to shoot the film, and I'm going to go. Now, after I'm finished the exam, I'm going to say, let me go and check with the radiologist to make sure that the radiologist doesn't need any more imaging done. I'll be gone in about 10 minutes. Are you warm enough? Would you like to have a blanket? You want a pillow underneath your knees? Would you like to sit up? You know, how can I make you comfortable? Okay? Because I'm going to be gone. How long did I tell her?
10 minutes.
10 minutes. So if I just leave the patient on the table, no sheet, no blanket, no explanation, what's happening?
The patient gets anxious.
The patient's getting anxious. Okay? How long has she been gone? Why did they leave the room and didn't say anything? Oh my God, they found something! I just know they found something. Why would she just leave me like this? That's what they think. Talk to your patients. Okay? So, now I'm back. I got back in 8 minutes instead of 10. You did so good. Those images were so good. Now, it's going to take a couple of days for these results to come from your doctor. So if you don't hear from your doctor within 48 hours, I would call them. Okay? I would call them. But it takes about 48 hours. Do you know the way out? Can I help you get out? You can go ahead and get dressed. I'll be waiting outside the door. And I'll show you how to get out of here. There's so many doors. I don't want you to get confused. Okay? What am I doing? I'm letting the patient, I care about you. Okay? I care. I don't want you to get confused. I want you to know that I care about you. Now, Harris Health System. You also have to consider the clientele. You have these little bitty ladies that come in. They've got on their church clothes. They've got on their silk pink shirt with their white gloves. They have their hat. Okay? It's the only time they ever get out is when they have to come to the hospital. Okay? When you go to get them and you see their clothes rumpled up, either on the floor or on a bench, hang them up for them. I'm going to hang these clothes. Let's take your clothes with you and put them on the back of the chair. Because what happens with silk?
Wrinkles.
It wrinkles very easily, and you can't wash and dry it. You have to take it to the cleaners. If I'm 89 years old, do you think I'm going to go to the cleaners once a week? Probably not. Be considerate of your patients. Pay attention to your surroundings. Okay? Let the patient know that they have 100% of your
Attention.
Attention.
yeah, your attention. that nobody's more important right now than them. Okay? And what does it take? Not even 5 minutes. Not even 5 minutes of your time. If that was your mother, would you appreciate someone being kind, looking out for her? Because you're at work, you couldn't get off. Your mother had to go, or your grandmother had to go to the hospital by themselves. They're lost, they're scared. You feel bad enough that you aren't there with them. And it's nice to have someone watch out after them. Okay, so always consider that. I don't know what that is. I don't know. It looks like it was probably a video. I don't know how to open it up. Okay. Any kind of imaging. Okay? Any kind of imaging. We're people oriented. We're here to serve the public. I was here during the majority of your interviews. What is the one thing that we looked for, or listened for, or read? What was the one thing? Anybody?
Drive,
Huh?
like the drive to be here.
Nope. Huh? Nope. What was the one thing that we looked for from everybody in this room?
Willing to help people,
I
customer
wanna help
service.
people.
Mhm.
Okay? If any of the applicants did not mention that, they were put it at the bottom of the stack. We took the first 16. Okay? If we didn't hear, I want to help people, I want to help the underserved, I want to learn how to take care of people. You know, that's how y'all are all here. Y'all all said it. Okay? None of y'all got put on the bottom of the stack. Y'all stayed on the top of the stack. Because we're hands-on. We're hands-on. We touch people. Okay? We touch people in places that normally wouldn't get touched by a stranger. Okay? And we're going to teach you how to touch those patients. Now, I'm not going to take a picture of Miss Bonilla unless I say, Miss Bonilla, I'm going to lay you up here, and I'm going to lay you flat on your back, and I'm going to take an abdomen. An abdomen consists of your bladder, and your kidneys. So I've got to make sure that I am where I need to be. So is it okay if I touch you? I need to find out where your waist is. She can either say yay or nay. If she says nay, what am I going to do? Can you put your finger at your waist? And that's where I'm going to center it. But I'm also going to cover myself. Okay? Miss Bonilla did not give me permission to touch her. Okay? So if I have to repeat that exam, I have documentation on why I repeated that exam. Miss Bonilla wouldn't let me touch her. Or Miss Bonilla requested a no-touch exam. Okay, I'm going to cover myself. Okay, so proficiency. Proficiency to me is how well you do your exams. Like, how did I talk to y'all earlier? I said, before I ever bring the patient in, I have everything there that I need. I'm not going to leave the room to get anything because I have everything there that I need. To me, that's being proficient. Okay? Because if I have to leave the room because I forgot my cassette, what's my patient going to think? Oh my God, something's wrong. Why did they leave the room? Why did they leave the room? They found something. I know they do. I just know they did. Okay? Be proficient. Have everything there that you need to do that examination. And as a student, I'm going to make sure that I have a sheet to cover them up with. Because if I lay down, I want a sheet. If I'm watching TV, I want a blanket. So why wouldn't I do that for my patients? Okay? I'm going to make sure I have my markers. Because I have to have my markers, or that competency that I just took didn't have my markers on it, it's no good. My instructors won't take it. Because my initials are not on that film. Okay? That's part of being proficient. Okay? If I know that my patient is going to be on the table for at least 30 minutes, because I have a C-spine, a L-spine, a T-spine, I have a right shoulder, and I have a right hand, what am I going to do before I ever get started? Do you need to use the restroom before you get started? Because we're going to be here for about an hour. Okay? Because there's nothing worse than getting started and you're on a roll, everything's going good, and the patient says, I have to go to the bathroom. And they're in the bathroom for 30 minutes. Well, you've already lost your mojo. You know? So try to take care of that. That is being proficient to me. That's my terminology. Yes.
Ma'am, what's the significance for marker? We have heard it in the previous class also, but I didn't realize until now, marker is going to show that it's my.
Correct.
Alright.
Yeah.
So the marker.
Your
will-
markers have left and right. They also have student and your initials.
Oh, I see. That will be telling the radiologist that I have.
A
taken
student
it.
did the exam.
Oh.
Like a trademark,
Huh?
like a trademark.
Correct.
Only for the students, ma'am.
Oh, no, everybody uses them.
Or even when you become a
Yeah, even
really good.
if I went into the hospital today because there's a national emergency, I would make sure that I had markers before I take my first x-ray. Okay? I have to tell the doctor what side I'm examining, what side of the patient I'm on, and who did the exam.
So the side you put it on will be the side you took the X-ray,
Yeah.
and that will your name will show.
Like if I'm doing an abdominal exam, I'm gonna mark my right side. Okay? If I'm doing a chest x-ray, I'm gonna use my left marker. Why? Because the heart's on the left, and I also do a left lateral decute. So I don't have to change markers. I use one marker for both images. Okay? That's being proficient. Because it's going to take at least, 10, 15 seconds? If I don't drop my marker to change from right to left, that's being proficient. You're thinking ahead. You're taking less steps to do the same job. To me, that's being proficient. Any questions so far? Now, my proficiency is probably going to be different than your proficiency. Okay? Because she's just now getting hers built. I've been doing mine for over 50 years. So my proficiencies are already implemented because that's who I am. Okay? Like when I worked at an imaging center. You never knew what you were going to do there. It could have been an ultrasound, a CT, an IVP, a chest x-ray, a hysterosalpingogram, a mammogram. You did it all. I could walk into a room and tell who just left that room. Why? Because I learned my co-workers' proficiencies. I recognized what they did before they ever left the room. Okay? I knew I didn't have to clean up after Caroline. I knew that the film bin was going to be done up by Judy. You know, I knew because they knew my proficiencies and I knew their proficiencies. They knew how I worked. In other words, they knew how I worked and I learned how they worked. Okay? Everybody understand that? Okay. Communication comes in multiple ways. Okay? What if I sat right here and all I did was radiologic technology is a people-oriented, hands-on profession that requires proficiency in a wide variety of communication skills. Emotions. The patients exhibit a wide range of emotions, and the way technologists handle those emotions relies on how well they understand not only the emotions exhibited by their patients, but also how well they understand their own. This understanding is known as emotional intelligence. Would you listen to me? Probably not. Probably not. Why? Why wouldn't you listen to me? I'm acting like I don't know what in the bejeebies I'm even talking about. Because all I'm doing is reading the slides. I'm not explaining it to y'all. I'm not putting the human element into it with you. I'm expecting you to understand me whenever I'm reading the slide without me ever explaining it, to put my own little spin onto it. Okay? So that's why it's important, because y'all don't know me from Adam. I don't know y'all from Adam, but I want to connect with y'all. I want to learn your names. I want to find out what y'all like to do. I want to find out how many children you have or where you live, or, you know, what do you like to do? Do you like fishing? I love to fish. Do I have a boat? No, but I love to fish. You know? And I want to know that information. Like if I have a patient come in and a patient is wearing, you know, those fishing shirts you can get from Academy. They have that little flap in the back. Oh, you like to fish? No, my granddaughter gave me this for my birthday. I don't fish. Oh, I have one kind of like that, but I love to fish. You know, what am I doing? I'm letting them know I'm connecting with you. Okay? It's up to them to either receive me or not. At least I've tried. That's considered emotional intelligence to me. Okay? Because I'm going to try to connect. For instance, I go to the waiting room and I say, Bonilla, oh, are you okay? Are you okay?
Yes, ma'am.
Okay. Well, you look a little distressed. Is there anything I can do for you? Let's go into the room so we can talk. Okay? I'm going to read her body language. If she's sitting in the chair crying, I'm not going to say, Bonilla, come this way. Okay? I can see she's upset. She's almost crying back there. I'm going to touch her. Are you okay? Is there anything I can do? Well, why don't we go to the room so we can talk? Okay? Now, what she says is between me and her. Okay? But if she's told me that her husband beats her, it's out of my hands. I've got to say something. That's my job. Okay? Because there are people in the hospital that know how to handle that situation. I'm going to tell my supervisor. My supervisor's going to connect that with that department. And before that patient ever leaves the room, someone's gonna be in there to talk to her. Okay? It's out of my hands. I've done my job. Okay? Just like if I see a car wreck, am I gonna drive right by it? Absolutely not. Because I'm an ARRT member. I'm a member of the American Society of Radiologic Technology, and I am sworn to stop, to render help. That's my job. That's what my license says, that I'm there to help. Okay?
Ma'am, I have a question.
Yes.
I was in the grocery store just day before yesterday. There was a gentleman who was probably went to pick up the water and he was folded on the ground, no more movement. And the two police people were standing there, not doing anything.
Mm-hmm.
And there were other people who were shopping and all. They were looking, but nobody was doing, because they're not allowed to do it. No, they're not allowed to, nobody's allowed to touch. I was wondering how somebody could have straightened him or done
Okay.
something. But if somebody had the card that you were
Yes.
wearing,
Okay.
they could have gone
The
and
police
said-
should have helped.
The police.
The
were-
police should have helped.
The both of them were standing and they were
Yeah.
looking at looking at him.
Yeah, and then I would say, are you gonna help them or shall I? Okay? More than likely, I wouldn't have to say that, I would just do it. For instance, I was in Target a couple of years ago. This woman comes running up to the, what do you call it?
Register, cash register?
Yeah, no, customer service. Running up to customer service, the baby's head was just like this. So I knew the baby was unconscious. And she was yelling, my baby, my baby, my baby. I didn't know what to do. I said, let me help you. Call 911. Yeah, 911. Okay, I took the baby from the mother. I didn't know what to do. The baby was having a seizure. I just laid the baby on the ground and I lifted the legs higher than the heart. I didn't know what else to do. But at least I kept the baby from hurting himself because he was actively having a seizure. And 911 had already been called because I was taking the baby as I said, call 911. Because the mother was hysterical. If that was my baby, please help me. Do anything that, help me. Take the baby. I don't care. Just save my baby.
My question to you is that if I didn't have the certification that you have,
You still obligated to start.
without it, I could have gone and helped.
You could have gone and helped.
Somebody could have helped that gentleman. then.
Yeah, somebody could have helped.
And without any.
And how would you do that? Are you okay? Are you okay? Just like you learn in CPR, right? Okay? If you see someone pass out at the park, are you just going to walk over them or past them? No, you're going to stop. Okay? Yes.
Bishop, one thing I was going to ask, it sounds crazy, but I don't know, I remember watching a show, What Would You Do, or whatever, with that one kind of guy. He's from, I forgot the show, but all I know, it actually showed people actually do there was some guy in the street for so many minutes and nobody does, but sometimes all it takes is that one person. When one person sees somebody stop, then other people get
Correct.
involved too.
Correct.
They do have.
And why is that for today? Today's day and time. People are scared of being sued. Okay? So, say I help that lady with the baby. Okay? Well, the baby died. Okay? She could sue me. But do you think the judge would send me to prison when all I was really doing was helping? The mother was hysterical. So you've got to weigh the consequences with the advantages. Yes.
I help people, but I never touched it. I'll ask a lot of questions.
Uh-huh.
I'll be like, are you okay? Do you need me to get, somewhere to help
Correct.
you? Can you move?
Correct.
But I don't touch them
Correct.
physically at all.
Correct.
I'll
have
call
to ask
911,
permission.
I'll call the police, and I'll even stand there with
Yeah.
you, but I do not touch anyone. I'll just keep asking them to, try to talk to them, keep them alert, you know, that type of thing, but I've never really go and try to move you if you fall. Because I've fallen and it was terrible, and I promise you, my husband tried to touch me, I was like, don't touch me.
Don't touch you. Mhm.
Just let the, you know, people come and move me.
Yeah.
But I don't touch people, but I always ask a lot of probing questions like, are you okay? Are you in here with someone? Is your mom here? Is your dad here? Is your, that's what I do.
Correct.
I don't touch them.
And that's the proper way to do it.
But if the person that tells you that, yeah, please help me sit or help me lie down, would you do it?
I would say we probably shouldn't move you until someone comes that knows that you should be moved. When the
Nice.
ambulance get here, they'll be able
Yeah.
to move you.
Makes
I think you
sense.
should stay there
Okay.
and not move. I would try
Yeah.
to talk them into staying put.
And
So it
that
don't hurt
is
nothing else.
protecting yourself, protecting yourself. But see, I'm from a different generation than y'all are. So it's also generational. I don't worry about getting lawsuit because my generation, that doesn't
You
happen.
go out and help them.
Yeah.
It seemed
I'm
like-
gonna jump right in.
Yeah, it seemed like weird that
Yeah.
nobody was helping
Yeah,
and
I'm
there's some
gonna
people
jump right
around.
in. I'm not even gonna give it a second thought, but that's generational. You probably wouldn't do the same thing that he would,
Yeah, I would.
because aren't y'all a different generation? How old are
How
you?
come nobody's helping?
Yeah,
him?
how old are you?
I'm 60.
Yeah, so how old are you?
20.
Okay, so how you respond to a situation is gonna be totally different than how you respond to the situation.
Right.
Okay?
So will I be judged in the same field?
Will you be judged in the same way?
Like these days.
Oh,
people-
absolutely.
They will,
Absolutely.
like he's worried about being sued. Would I be? But should I have been worried about being sued?
I wouldn't care.
So it's also like
Yeah.
a conscience.
Yeah,
Okay, like really?
it's kind of like your upbringing and your culture can also make a difference.
Ma'am, it was quite awkward that he was lying there
Uh-huh.
and people were looking and walking away. Nobody was
Mhm.
doing anything. They're waiting for the paramedics to come.
Yeah.
And then.
And nobody was trying to make him comfortable,
Yeah.
give
Which
him
would
a
have helped
chair,
probably.
lay him down.
Yeah, he was
Nothing
really
was
on
happening.
his forehead and like folded.
Yeah.
And on the
Mhm.
water bottles.
But you wanted to help, right?
Yeah, I didn't. Yeah.
Yeah, you wanted to help. Did you look around for a chair? Where's a chair? Where's a bench? Okay, so it's generational, it's cultural. Okay, because there's certain cultures that
You need to.
that women only touch women and men only touch men. Okay, there are cultures where they only want their family members to help them. Okay, there's cultures where they're totally accepting. Okay, but you have to read all that information. You have to think about that information. You have to think, what would I do in that situation, or what would they do to me if I was in that situation? There's so many different things. Like if you have an emergency, don't let fear keep you from helping. Okay? Because you are a member of the medical field. You're obligated to help. It's in your decree. When you get your license, it's part of it. Is it still there? Yeah. If I pass a car wreck, I stop. If I pass someone on the ground, I stop. I don't have to show my ID. I don't have to show my CPR. They know when emergency people get there. They know, because why? How does an emergency personnel know that I'm here to help?
Because you'll know what to do. Probably if you didn't get
It's the language that I talk to them in.
Right moves everything.
Okay? It's the language that I use when I talk to them. I just saw him collapse. I didn't know what to do. I laid him on his back. I raised his head. I raised his feet higher than that. He seems to be reactive. A normal person's not going to say, oh yeah, he's reactive. You know, but a medical person would. Okay? I'm going to use the terminology that lets them know that I'm not Joe Blow. Okay? Everybody on the same page, or am I way off subject? I can get way off subject though, real easy. Okay? Because I'm a talker. Okay. So, emotional intelligence, it has a very conglomerate of things that go along with it. Self-awareness. What is self-awareness? I can help. I'm aware that I can help. I know what to do. I've been taught what to do. That is self-awareness. Okay? I'm going to react to my brother's a welder. I'm going to react to an emergency different than my little brother is. He's a welder, for God's sake. If my brother collapses in the yard, he's just going to say, Georgette, Georgette. You know, he's not going to know what to do. Okay? That, to me, that's the definition of self-awareness. I know what I'm capable of. Social skills. Okay, so social skills. To me, social skills means I'm going to be like a chameleon. Okay? If you invite me to supper one night and your mother and your grandmother and your grandfather are there, I'm going to talk to, at the dinner table, I'm going to have a whole different conversation than if it's just a bunch of us. To me, that's social skills. Okay?
Know what to talk when.
I'll know what to say around certain people. Just like if I am talking to the radiologist, I'm going to use a different language. I'm not going to say, well, you know, the patient, he was kind of funky. He wouldn't lay still. I had a hard time with that arm. I'm sorry I couldn't get it perpendicular, but I don't know what else to do. You know, if you want to come and do it, you're welcome to try it, but I'm not going back in there. How do you think that would be accepted? Probably not. But if I told the radiologist the patient's in extreme pain, I tried the best that I could. I even used the upright bucky to see if maybe I could get a true lateral, but the patient is in extreme pain. If you want to wait until after the emergency room comes down and gives the patient a pain shot or whatever, I'll be glad to try again. But right now, this is as best as I can do. Okay? Empathy. What's empathy? Anybody done like the Berkman or?
Empathy is either you have it or you don't.
You either have it or you don't.
I don't think you can learn empathy.
You can't
That's
learn it.
My take on it.
Yeah, you can't learn it. You either have it or you don't. Okay, so Myers-Briggs, Berkman, there's another one, I can't remember what it is. All three of those, empathy is my number one. It's my number one. But empathy is it could either be a good thing or it could be a bad thing. If you cry, I'm gonna cry. I can't help myself. Okay, you laugh, I'm gonna laugh. Yes.
Like a feeling?
Huh?
Like a feeling is empty.
Yes, other people's feelings, not yours.
Oh.
Okay?
If you have an understanding of what they're going through.
Correct. Okay? Like if you have test anxiety and I see you have test anxiety, I'm going to stand right here with you. I'm going to let you know that I'm here. If you want to ask me a question, I'll be glad to answer it. Okay? Okay? Because I'm not going to leave you.
Alright.
Okay? 'Cause I know you have test anxiety. Just don't throw up on me, okay? 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 Empathy. I can feel what other people are feeling. It could be a bad thing, it could be a good thing. It runs both ways. Dr. Black's favorite nickname for me, Crybaby. I cry every graduation. I can't help myself. I just look out there and I see everybody just so happy. I just cry. Okay? Motivate. You're not going to find a better motivator than me. I'm going to make sure you get this, no matter what. If I have to sit here with you till 10 o'clock tonight, by God, you're going to get it. Okay? I'm going to make sure you get it. And you're not leaving because you're going to help me with it. Because I'm a good, this is what we're going to do, and you're going to help me, and this is the way we're going to do it. I'm a motivator. That's why I'm in education. I motivate people to be better than me. Because that's my goal. Okay? If we struggle along the way, we struggle along the way, but at least we're together. Okay? What's the other one? Self-regulation. Oh, I'm terrible with that. I don't regulate what comes out of my mouth. And my mouth can sometimes get me in trouble. Yes.
5 minutes.
5 minutes, okay. 5 minutes, thank you. So, self-regulation, out of everything here, this is probably my worst. This is the one thing that I have to work with the most. Okay? And why is that?
Carefree.
Yeah, I'm carefree. What else?
I mean, it's just, you have to just be careful sometimes what you say.
I have to be very careful with sometimes that I say. Because sometimes my mouth gets ahead of my brain. And I say things that I shouldn't be saying. Okay, that's the one thing that I have to really be aware of.
Sometimes people just don't know what to say, so, and that.
Oh, but you'll never see that with me. If I don't know what to say, I'm still going to say something. Does that make sense? I have to say something. I can't be quiet. I have to say something.
It's like getting the last word. You kind of like, you know.
Probably. Yeah, probably. Like my daughter and my granddaughter live with me. I've learned self-regulation through them. I've learned to let them have the last word. Because if not, I'm going to throw something. Okay? I'm telling y'all too much about me. Okay. So, out of all of these images, which one shows pain?
Pain?
Pain.
That last guy at the bottom. Yep.
I would say probably it's going to be this one. Okay? And y'all were all in agreement. And all y'all did was look. Which one is silly?
Quite a few of them.
Yeah, there's a lot.
Yeah, there's a few of them.
Right here on the second row.
Yeah.
Top row, yeah, top row.
This one's silly, this one's silly, this one's silly.
That one.
You know, because we're reading,
The
our
facial
people.
expressions.
okay? Now, whenever I went to Miss Bonilla earlier, she was probably here. She was probably here.
Without expression.
Because I read her face, and she looks like she could almost cry. Okay? So I'm going to say, are you okay? Let's go into the room so we can talk. I'm not going to talk to her and let everybody know her business out in the waiting area. But if she's my patient, I'm going to take care of her. Okay? Oh, look at this one. Okay, which one of these is mad?
That first one.
The first one on the bottom. Okay, the first one on the bottom. What does this one say? You want me to do what?
Surprise.
You want me to do what? What does this one say?
Don't look me,
I
please
don't
don't
Oh,
look me.
I don't like this very much. Okay, I don't like this.
But
very
this
much.
guy's in pain.
Do I have to?
No,
Are you
it's-
sure?
It's probably in pain.
You know? Because some of you might leave Harris Health System once you graduate and work for Texas Children's. And that's all you do is pediatric work. Okay?
X-rays only for children.
X-rays only for children.
Is that difficult?
Yes.
Because children are. Because they probably don't want to get it.
Yeah. Me, I like geriatric work. I love those little bitty old
Yes.
women and men. They just hug me, and I just love it. I hug them, they hug me. I love it. I love geriatric work. Okay.
Ma'am, for children, you have to specialize to do the radiography, or is it the same?
Can you specialize?
Like,
do
can
you
we?
need to specialize before you join?
No, no, because we teach you everything. Okay, we teach you everything. But who's to say that you're not going to get a mobile X-ray job and that's all you do is go to nursing homes and take X-rays all day? You just take your machine and you go to different nursing homes, and you might love that. I know I would. You know.
It's 11:30.
Huh? It's 11:30. Okay, I gotta go. Okay, if you want your picture taken, let's get Miss Adger. And let's get your picture. I know that some of you said y'all didn't want them done today. But let's try to get them all done today.
Now, what
so
are
we
these
can get the
pictures
roster.
for, ma'am?
For your roster. See back there where it says family, that yellow piece of paper? That's a roster. That helps y'all know each other's names, because we also give you a copy of it. It helps us learn your names, and it lets the clinic know who to look for whenever you start clinics in September. Okay? So I think I'm signed out. So let me get Miss Adger, and we're gonna take pictures at the front of the office against that brick wall.